that the body has the ability to heal itself? It is the same philosophy of like curing like, a branch of medicine founded in Germany and has been mostly practiced in some parts of the world. This method is used to maintain good health and treat a wide range of illness. A safe way to remedies with regulations in the United States of America several years ago. It is homeopathic method of treatment.
Radionic computer analysis, a system of medical diagnosis tested, trusted, and approved by all medical radiesthetists worldwide.
You want to know more about it? Join our homeopath, Dr. Amadi Gutspower, in an interactive live session, Your Health Portal, taking you through the world of homeopathic therapy.
Kindly be with me on this program same time every week for all your inquiries and questions on electronic homeopathic medicine.
With radiotherapy treatment, I have tried it, it has worked for me.
Coming to you every Monday at 7:30 p.m. on this station. Hello viewers at home, you're welcome to Your Health Portal. My name is Anna Adjose. Now on today's show, we will be doing all we can to put some answers to some of the questions that you've sent to us, and as well as taking today's topic from last week's topic, which is the accentuations of various chronic miasms. Now we're talking about the homeopathic method of treatment, and it's a very interesting topic, and I hope you'll stay tuned after this short break. Do you know about homeopathic remedies? Do you know of a medical philosophy that the body has the ability to heal itself? It is the same philosophy of like curing like, a branch of medicine founded in Germany and has been mostly practiced in some parts of the world. This method is used to maintain good health and treat a wide range of illness. A safe way to remedies with regulations in the United States of America several years ago. It is homeopathic method of treatment.
Radionic computer analysis, a system of medical diagnosis tested, trusted, and approved by all medical radiesthetists worldwide.
You want to know more about it? Join our homeopath, Dr. Amadi Gutspower, in an interactive live session, Your Health Portal, taking you through the world of homeopathic therapy.
Kindly be with me on this program same time every week for all your inquiries and questions on electronic homeopathic medicine.
With radiotherapy treatment, I have tried it, it has worked for me.
Coming to you every Monday at 7:30 p.m. on this station. You're welcome back, viewers. For those of you who have just tuned in, this is Your Health Portal. It is a homeopathic method of treatment. Now, last week we discussed on a very interesting topic, accentuations of various chronic miasms. Now, we have our homeopath in the house, our Dr. Amadi Gospel. Welcome to the show, Doctor.
Thank you. Good evening.
Now, Doctor, from last week's topic, I understand that SORA is referred to various skin eruptions, or we could say patches, that have been badly treated when they become suppressed in the body, right?
Sure.
Okay, now, today are we going to continue on the latent SORA, or we're still going to talk on suppressed SORA?
Well, thank you. Good evening, viewers. Well, I think it's better we finish up very well, finish up latent SORA. I know time was not our friend that day, and then we'll finish latent SORA and then enter into full-blown SORA. That's full-blown SORA in the platform of homeopathic therapeutics. So can we go on that?
We can. So are we starting with suppressed SORA now, or latent?
Yes. Suppressed SORA results to latent.
Okay.
So when SORA is suppressed in the body, that human being is moving like a healthy human being, like every other healthy human being, but there is what we call latent SORA. Okay. So this latent SORA, we describe some of the symptoms of people that have latent SORA. We said that sometimes they are short of memory. We said that they are easily fatigued and tired. They see a big work now, they are eager to do it, but the moment they start it, they are also tired immediately. We also talked about the menstruation in women when some questions came. We did say that the SORA, the type of menstruation that is as a result of latent SORA should be that one where the menstruation is cut off. There is no menstruation at all. That is not the same thing with where we have irregular menstruation, as in the case of psychosis, when we come into psychosis. Okay. And you remember we said that these, according to homeopathic principles, these are the various causes of chronic diseases. Okay. That is SORA, psychosis, syphilis, and then the youngest one now is tuberculosis miasm. So viewers, last time we were talking about latent SORA, and that is suppressed SORA. When we have discussed all this now, in the reproductive side of it, which we wanted to say that day before time told us that is nobody's friend, you see that the type of impotency or the type of erectile dysfunction that will be caused by latent SORA is that which there will not be any movement at all. You cannot liken this to that where there is movement of, that is, there is slight erection, but it is not strong enough to penetrate to perform reproductive duties. But in this case, there is no slight movement at all. In fact, the organ looks like a dead rat, sometimes sweating. That is as a result of SORA. So, but now what happens when SORA becomes fully blown, and what blows it up? When people are moving about with latent SORA, sometimes it can be a little thing that can provoke the full explosion of SORA, because this time now it is lying like a sleeping serpent inside the inner body viscera, that is deceiving the vital force of the inner viscera. The vital force can be likened to the human immune system in the general medical context name, but to homeopaths we refer this as the life vital force. So you can see the SORA lying down with the vital force, moving together. Now, instead of the normal dynamic actions of the life vital force, take for instance, we want to write paper, you can write. Now, where there is latent SORA, you want to write paper, the hands want to move this way, but the latent SORA pushes it the other way. So it's now dragging with himself, sometimes distortions that are not harmonious, as in terms of a healthy human being. That is it. So, but now, he may not be fetching firewood. If there is any slight mishap and there is a crack inside, behold, this can explode latent SORA. Apart from that, if now there is a strong emotional factor, like the daughter is suddenly dead, the daughter is suddenly lost, now the severe thinking, or one is embarrassed or publicly disgraced, now one may continue thinking and perusing on these thoughts to the extent that the inner vital force is now touched where this latent SORA is relaxing, and now this can provoke the latent SORA into full-blown SORA. Now what happens? That is where we say the accentuations of SORA is disinclination. Disinclination here means that if now you are moving normally and now SORA is fully exploded, at a time now we will have what we call chronic rheumatism. Many other systems may have their own way of branding it or labeling it, but in homeopathic medicine, especially classical homeopathy or electronic homeopathic medicine, we know that we have acute rheumatism, we have chronic rheumatism, we also have gonorrheal rheumatism. These are the ways we classify them. So in this chronic rheumatism now, you will see that the patient suddenly cannot move. If he wants to trek from here to Surulere, the moment he moves up to one pole, he is tired. The leg cannot move again. That time we say that the accentuation of SORA is disinclination. That's no more inclination to move. Okay. So the homeopath will simply see it that this may be as a result of full-blown SORA. Not only in the extremities that we experience this, sometimes even in the common eyes, you see the upper eye closing down without any reason. We now see that this is accentuation of chronic miasm SORA, where there is what we call ptosis. Ptosis now, you see the upper lid closing down. That is disinclination. The eye is disinclined to work. And apart from that, in the visual aspect of it, the iris, the pupils, all these may immediately clench down. And now it's as if there is paralysis of the orbit, you know. So when this paralysis occurs, there is no more movement in the eyes, and we say disinclination. That means the eye cannot move. Not only in this, in also reproductive system, even in women, apart from men whose erection cannot move at all. Sometimes you see women, instead of the os being fully dilated, you see it contracted to the extent that even the little finger of the midwife cannot be able to penetrate. Okay, in that time we say, it's disinclined.
Sorry to cut you short, but we'll take a short break now. We'll take a short break, after which the doctor will continue with this discussion. Do you know about homeopathic remedies? Do you know of a medical philosophy that the body has the ability to heal itself? It is the same philosophy of like curing like, a branch of medicine founded in Germany and has been mostly practiced in some parts of the world. This method is used to maintain good health and treat a wide range of illness. A safe way to remedies with regulations in the United States of America several years ago. It is homeopathic method of treatment.
Radionic computer analysis, a system of medical diagnosis tested, trusted, and approved by all medical radiesthetists worldwide.
You want to know more about it? Join our homeopath, Dr. Amadi Gutspower, in an interactive live session, Your Health Portal, taking you through the world of homeopathic therapy.
Kindly be with me on this program, same time every week, for all your inquiries and questions on electronic homeopathic medicine.
With radiotherapy treatment, I have tried it, it has worked for me.
Coming to you every Monday at 7:30 p.m. on this station. You're welcome back, viewers. For those of you who have just tuned in, this is Your Health Portal. Now, this is the homeopathic method of treatment. Doctor, for those that are hearing this for the first time, I understand that the extra responsibility of regulating and standardizing the homeopathic method of treatment was introduced in 1992. Before then, what were you doing before then?
Okay, they were not actually introduced in 1992, but that extra responsibility was handed over to the Medical and Dental Council of Nigeria. Okay. That is the sole authorized body that regulates health practices in Nigeria. Okay. Well, as you asked rightly, before then, that was when we were referred to as quacks, before then. Because sometimes we'll be practicing, and when you sense that policemen are around, you pack and run away. So because you dare not be caught, when you are caught, they take you to court, and some other practitioners will come and witness against you. So, but glory be to God that government took the responsibility on its hands, and then actually recognized homeopathy after visiting some other countries like the United Kingdom, United States of America, India, where homeopathy are being practiced to the full. In fact, where homeopathy seemed to be their own orthodox. So based on that, now that extra responsibility was handed over to MDCN. So right now, I think the sole regulatory body in Nigeria is still the Medical and Dental Council of Nigeria, who regulate and standardize the practice of homeopathy, even though some people are still agitating that they should be on their own as a NACAMA, that is National Alternative and Complementary Medical Association of Nigeria.
Okay, I actually asked that question so as to enlighten the viewers on some of these things we are discussing, because some may have some mixed feelings and all that. But a question came in, Doctor, if you don't mind, can I?
Let's go.
Okay, it says he's been suffering from staphylococcus for some years now, and every effort has proven abortive. Even the herbal cure did not work. So.
Okay, well, my dear, this case of staphylococcus has put some people into real confusion. But then it's not the fault of your doctor, and it's not the fault of those who have consulted. Most times people are very careless on their own. You see, the bacteria called Staphylococcus aureus is very, very viral. That is, the reproductive rate is very, very high. So in 5 minutes now, staff can reproduce so much. And the presence of staff in everywhere now is recognized. In the hospital, on the table, everywhere there is Staphylococcus. So, but when people are having growth of Staphylococcus aureus bacteria and they consult their doctor, it is very, very good when your doctor treats you or prescribes for you. The moment you go, it's very good you maintain high level of cleanliness. This is because most times, the time we shave, sometimes we give ourselves some cuts and wounds. That will not make the doctor that has treated you of Staphylococcus aureus, he will not be there to tell staff not to enter through those holes you can see. So most people are careless. Sometimes also some people scratch and itch, and without handling that, they give themselves wound with their nails. And the doctor that has just treated you of Staphylococcus aureus may not just be there to stop them from. So what I'm saying in effect is that even when you shave your beards, the cuts you have there, staff can enter there. So that you have treated staff today in this hour does not mean that in the next hour, if staff sees the way to penetrate, it will not penetrate. However, try your possible best when you tell your doctor that you have this overload of Staphylococcus aureus, maybe based on laboratory reports. After your treatment, try to go back for confirmation that it has actually been cleared. If it has not, let the doctor know. I think he will be in a better direction to direct you. And the moment you confirm that it has, you have gained that freedom from Staphylococcus, or you have gotten relief from it, then you keep this cleanliness up. But if you have been using a particular place for a long time and you think that there has not been that relief, you have the right to go out there and search, and until you get the right place where you can actually get the relief. I think homeopaths, they do introduce this comprehensive computer test for people, not only to ascertain if there is overgrowth of Staphylococcus aureus, but also sometimes to analyze the various healing remedies and know the one that vibrate to the same equivalent with the case at hand.
So it is important basically to stay clean and healthy. When you shave, you know that bacteria are everywhere.
Exactly.
So doctor, like you were saying before we went on the break, latent sora.
Sure. So we have gone away from latent sora now into full-blown sora. Now we can experience full-blown sora right from the head, where the man feels it impossible to even think. Daddy, 18 plus 18, what is it? He said, please don't disturb me. That is disinclination. Cannot think that. Now in the visuals, he cannot concentrate or picture the eyes in one direction. That is disinclination. The eye cannot work. Now in the hearing, he does not even hear. If he wants to focus his ears, he will hear boring sounds. That is disinclination in the hearing. Even in the mouth, sometimes the orbicularis oris of the mouth becomes strict. And that means disinclination, to the extent that this patient will not even be able to whistle. You know the common whistle? Yeah. Now, tell that patient to whistle, he cannot be able to whistle because there is disinclination. Not even only in that, even in the chest. When the person is moving, at a time it seems as if there is a strict something hooking somewhere. Some people call it angina pectoris, and some people say pericarditis. But then, when it is as a result of full-blown SORA, you see the person wanting to stop, because it looks as if he continues to move, something will happen. So he stays at a place until he regains himself very, very well. Down into the reproductive system, as we said, down into the extremities. So now can we go into the next miasm, the psychosis?
Okay, good.
Okay, so that is to deal with SORA. Remember, we were talking about the causes of chronic diseases, and we did say that this is far away from acute diseases, which can actually be caused by immediate circumstances, either the weather condition or our diet or our behavior, social behavior or otherwise. Those ones are the acute cases that with a little treatment, one may get relief from them. But then we now took on the chronic diseases. We said that these chronic ones seem to look like the ones that have taken an oath that they will not separate from the person except death come. And now we are saying, how do homeopaths handle it? And in case you have such problem, you can better go out and maybe inquire from your doctor and find out the right thing to do. But it is also good to master the particular symptoms you ought to know, at least from the perspective of the electronic homeopathic practitioner, so that you will not be taken unawares when you see them. So the second miasm that causes diseases, first is SORA, second is psychosis, third is syphilis, and final is tuberculosis. We have treated SORA, and remember, SORA is a Greek word that simply means the itch. The itch simply means all excoriations on the body, eruptions on the body, which we are badly managed or badly treated until they become suppressed into the body and start disturbing the inner vital force, and in the form of latent SORA, until they are hit by a serious thing that makes it exploded.
Okay,
so
doctor.
we will now come into psychosis.
Yes, we'll come into psychosis, like the doctor said, after this short break.
Do you know about homeopathic remedies? Do you know of a medical philosophy that the body has the ability to heal itself? It is the same philosophy of like curing like, a branch of medicine founded in Germany and has been mostly practiced in some parts of the world. This method is used to maintain good health and treat a wide range of illness. A safe way to remedies with regulations in the United States of America several years ago. It is homeopathic method of treatment.
Radionic computer analysis, a system of medical diagnosis tested, trusted, and approved by all medical radiesthetists worldwide.
You want to know more about it? Join our homeopath, Dr. Amadi Gutspower, in an interactive live session, Your Health Portal, taking you through the world of homeopathic therapy.
Kindly be with me on this program, same time every week, for all your inquiries and questions on electronic homeopathic medicine.
With radiotherapy treatment, I have tried it, it has worked for me.
Coming to you every Monday at 7:30 p.m. on this station.
Okay, viewers, you're welcome back. Now we've been discussing on the various chronic miasms that we have, which are the SORA, the psychosis, the syphilis, and the tuberculosis. Now the doctor, the homeopath, has explained to us what SORA is, which is the itch, and now he's going to tell us what psychosis is. You're going to tell us briefly what psychosis is.
Okay, thank you, viewers. So psychosis to a homeopath simply means all those diseases that result from bad management of all venereal diseases. Venereal diseases include your gonorrhea, your E. coli, your whatever that may cause one discharge or the other. When they are badly treated, that is when you refuse to go to a qualified personnel and you rather prefer to go to a roadside somebody or prefer to use one thing or the other on self-medication basis, and then you cut off that discharge. That is when we have problem. When you cut off this discharge, we now have what we call suppressed infection. When this infection is suppressed, sometimes men start having boborygmy, that is noises in their abdomen, including women too, and sometimes people go further to use further wrong things to still treat that boborygmy When this noise is stopped now, there may be what we call cauliflower growths around the groin of men and women. These cauliflower growths, sometimes they itch and itch and itch, and one refuses to know that it's on the main road and he's still itching. It's sweet so. And when you smell it, you see that it smells so badly. So this is called cauliflower growths. So cauliflower growths is another name for psychosis. So that is what it is.
Okay. Okay, doctor, sorry to cut you short there. Do we have any humor for today? Our homeopath is always having different humors for us. Do we have any humor for today?
Thank you. The time is not our friend, but then I learned that there is one policeman, his name is Delay. Delay is dangerous. And one man who people used to tell that he resembles Sam Loco. His mother died and he was carrying a coffin to the mortuary and wanting to meet up by 3 o'clock. But the go-slow was too much because Mr. Delay is there. He didn't know what Mr. Delay was doing, so he quickly planned what to do. And this man that resembles Sam Loco takes drugs. So he told the taxi man, come along. He took the coffin on his shoulder. He moved. God Delay, don't you know me, Sam Loco? I'm dead. Where they buried me, I don't like it. I want to relocate to the other side. So the man called Delay quickly told his sergeant, oh yeah, sergeant, no delay, delay is dangerous. So they ran away and the road cleared. So I think this made our patients to laugh, and also it's supposed to make
And I hope it made you laugh as well. Okay, we've come to the end of today's show. I hope you'll join us same time, same station next week for another interesting show. It's your health portal. See you next time.
Radionic computer test. Are you sick? If your answer is yes, then legally, socially, and culturally, you are entitled to this information concerning radionic computer analysis, diagnosis, and treatment. In our radionic computer test, all you do is to give us a specimen of your blood or urine, which we insert into the radionic computer machine and analyze all your body organs, tissues, and cells, including the auric, the mental, and emotional system, irrespective of disease.